We're here today with Dr. Amy Hartsfield from TMJ and Sleep Solutions of Alabama. Dr. Hartsfield spends her time helping people who are dealing with chronic pain, headaches, sleep issues, fatigue, and other related symptoms. And she helps them by looking for the source of the problem, not just treating all of the symptoms. We're doing a whole series of videos around this topic, and if you haven't watched the other videos we've done around this topic, I highly recommend that you do. Dr. Hartsfield is covering all kinds of topics from hormones to sleep apnea and everything around that. In this video in particular, we're going to be talking about how Dr. Hartsfield treats her patients on a very individualized level and kind of what that looks like. So let's dive in. Tell me just kind of in general what makes your practice different and your approach different from maybe like a quick symptom-focused visit that people might be expecting.
Listening.
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 That's simple, and yet
listen to the patient. My practice, of course, as you will, we will discuss as later on another video, is built around kind of my journey of pain. And I went to doctor after doctor after doctor, from rheumatologist to neurologist to, ENTs to endodontist, things for my pain syndromes. And I got tired of not being listened to, and I got tired of medicinal feel.
Okay.
So from the very beginning, I set up this practice to not be that way.
Yeah.
So when you walk into my practice, it does not have the normal waiting room appearance.
Okay.
It actually has more of a living room appearance.
Okay.
And then when you come back, it's just in our office, our operatories is what we call them, but basically our patient care rooms. I don't want it to look so medicinal. So, But I mean, that's just kind of like the overlook of the office. But the other thing is just listening. Like, I spend probably an hour and a half with each new patient for pain.
Wow.
Because pain is affected by many things, and it can be also emotional things. So we go through, things and questionnaires of even what's called a PHQ-4 or 8, or, there's several different ones. I'm sorry, 9. But anyways, it talks about anxiety and depression. Like we go through that. Like somebody might be a PTSD patient and I need to know that, so their pain may be coming from the PTSD. So listening, I would say that's my number one thing is listening.
It sounds like it should be a given everywhere.
Right.
But we know that it's not. So I think that is a huge differentiator for you. That makes you very special. Talk to me a little bit more about understanding the whole picture of the person. So we've sort of touched on this in some other videos as well, but when someone walks in and you're sitting down with them for that hour and a half visit, can you kind of go into a little bit more of what you're looking at and kind of all the things you're considering?
Sure. I mean, so I get a lot from their medical history. I go through their medical history first.
Yeah.
Their family medical history, a social history, a review of systems, basically anything else going on the rest of their body, and their sleep before I even start my exam. Because I tell people I get a lot out of that. I'm looking for disorders, diseases, and deficiencies.
You need context, right?
Yeah. I call it the 3 Ds: disorders, diseases, and deficiencies.
Yeah.
To try to get that patient care. And so I get a lot of information. That's what takes me so long. I get a lot out of that.
Okay.
Then I go into an exam.
Okay.
Because if you're not getting the whole picture on an exam. You don't know about the patient. You know about the physical features of a patient, but you don't know about everything on the patient. You don't know that they may have like restless legs when they sleep, or they may have other joint pain. If they have other joint pain, and then I'm thinking, is this, something else like a rheumatoid arthritis is setting up in the TMJ, So whatever it is, it's just, I've got to figure all of that out. I mean, I have patients, let alone like everything is to do with like the anxiety. And so we go over that. And if their pain is to do with their anxiety, their sleep is to do with their anxiety. So we just have to get the whole picture, and we can't just focus on one certain physical aspect when you do the exam. And then we get into the exam.
What do patients say after they meet with you? Do you ever get to hear from them about their experience and what it was like?
Actually, my person that basically goes in and explains the treatment to them has always asked, how did it go? And the one thing that patients always say is that, wow, she listened to me.
Oh, which means so much to you, I'm sure.
Finally I feel listened to.
Wow.
So I would say that's the number one thing. But then also just getting a diagnosis, the correct one. A lot of times, I think I told you before, like people will be told they have trigeminal neuralgia and they've been through the ringer with trigeminal neuralgia and all the treatments for it, and they're not any better. And I explained to them that it's actually what's called a trigeminal neuropathy, and it's totally different,
Wow.
different treatment. So, I think just being listened to and then getting a
Mhm.
diagnosis
Mhm. Mhm.
and hope. Actually, the other thing is hope.
A
They
lot
feel
of hope.
Yeah.
I mean, you don't normally think of a diagnosis as a good thing,
Right.
but in this case, when you can label it properly and then begin to treat it, so
Mhm.
much relief must come with that.
Yes.
So when we talk about better sleep, how does treating someone's sleep and understanding and listening to them, how do those two things go together?
Well, I tell patients all the time, like I said, it's God's best form of repairing pain.
Yeah.
So we get into making sure, because a lot of times, this is a really good statistic. Basically, in medical school, they give 2 hours of sleep education to doctors. That's it. And I've actually had to go speak to residents at our big university here,
Mhm.
and that is usually on PTSD soldiers. So
Wow.
if their doctors were not educated, it's not their doctor's fault. If they're not educated enough, the only ones that are that one that specialize in sleep.
Yeah.
So if they're not educated enough, then they're just getting unnecessary medications that are covering up something else.
Yeah.
So we get into all of that, like, with my patients, whether it be, you know, I use a medicine that helps them sleep that can help their pain, or we
Mhm.
look at their sleep and find out if they have a sleep breathing disorder or if they have any other type of sleep disorder. Sleep study's not all about a sleep breathing disorder,
Yeah.
so we can find other things in a study when they go to an in-lab and they're different stages of sleep.
Mm.
So it's very important, especially in my pain department of my office, is to make sure that they are sleeping properly so
Yeah.
they can get that best pain repair. And again,
Yes.
like I'd mentioned, there's a one stage of sleep that's very important for that, and it's your deep sleep. And
Yeah.
so measuring that in an in-lab, we can find that out.
Yeah. So a second ago, you mentioned something called the 3Ds, and you
Mhm.
did say what they were.
Right.
But we went quickly through that part. And I think it's important, maybe as things are starting to feel a little bit more cookie cutter, as people are, when you go into a medical clinic, a lot of the time it is, what are your symptoms? Okay, here's the answers. Okay. And then you're out the door.
Mhm.
So can you kind of explain a little bit more about the 3Ds that you mentioned, and then also how you're using that to sort of set yourself apart in this industry?
Sure. So my 3Ds, again, I guess
Mhm.
in short, are disorders, diseases, and deficiencies.
Mhm.
So all of those can affect a person with pain and sleep. So what I do is, of course, I'm looking at blood work for some of that. Is there a deficiency? We do vitamin deficiencies somewhat. Not somewhat, quite a bit.
Yeah.
And then, but also, is it a disorder?
Yeah.
We're going to be, if we need to look at their sleep and actually send them for a sleep study, like their primary care may have been like, oh, you're not sleeping. And they just hand them a medication
Sure.
and they haven't like really looked and delved into it very well.
Mhm.
And so I will go into finding out what's going on. We
Mhm.
may do a sleep study for them, and we may send them for a sleep study, I should say, and
Yeah.
find out what's going on versus like the medication. So also, like a lot of diseases cause chronic fatigue. Like looking
Yeah.
into that, like they may have been complaining to their primary care about fatigue, but they may not know that it is actually coming from something else. Like they may have inflammatory markers that are up. And when you have inflammatory markers up, then you're just fatigued all the time.
Okay.
So we try to get into that because basically when you go to your primary, they do great, but they are looking at what's called a CBC and a CMP, and that's just your basic blood work.
Mhm.
So we get more into like that, and everybody's like, "Oh, I've had blood work by my doctor," and I'm like, "I promise you, it's not the blood work I'm looking for."
Yeah.
I'm not going to look at your CBC and CMP. I'm not your primary care, and I'm not going to, take
Yeah.
over primary care.
Right.
We need the primary care physician.
Yeah.
But I'm here to aid that primary care to find out what is going on. So
Yeah.
we get further into it. And I feel like sleep is missed a lot of times. I think I have mentioned to you before, like I have one right now that's in her 50s, didn't think she needed a sleep study. And our primary care was very smart to say, your fatigue may be for your sleep study.
Okay.
And you'll have a woman that is tiny that
Yeah.
stops breathing, like this one's 47 times per hour. And people's like, what is that like? But you don't know that you're doing it. You may not be snoring. It may be just little cessations of breathing. And she is literally severe apneic and not really snoring. And people don't understand that. So we look into that and we try to find out what all is going on with them. She came to me as a pain patient, and she was like, "Oh, I don't think that's sleep study. I don't think so."
Wow.
And I'm like, we got the results, and we were like, yes, like, do you want to die in her
but
sleep?
on the surface,
on the
you never would have
surface,
known.
And their primary care wouldn't have known. You know?
Yeah.
Well, I mean, that primary care did order it, but she also was a failure for CPAP. So, kind of even that in the individualized care in the office is like, I may talk to a patient about their sleep and they may get diagnosed with sleep apnea. Just because I do dental devices doesn't mean I'm always going to say, hey, do a dental device. I put plenty of people, I've referred them back to have a CPAP put on them. And so, but we do the dental devices as well. And so I will treat that, and get the patient some hope because, they're just getting pilled to death,
Yes.
And so there's alternative treatments other than pills.
Yes.
And medicine. And so that's kind of in my practice, I think about that. Like I hate to use the word integrative because I feel like it's so overused right now, integrative medicine. But, it kind of is. Like, I'm not just going to hand them a pill all the time. Right. I'm going to talk to them about sleep. We talk about nutrition. Yeah. I mean, I talk about nutrition. Actually, I've treated many of pain syndromes with, you have a gluten sensitivity, which causes you to have migraines and joint pain. Yeah. And they're like, oh my gosh, I gave that up and I feel much better. Yeah. We talk about eating processed foods. Like, that's a huge deal. And people are starting to understand that. I feel like it's gaining ground now, but I mean, it's like, don't eat it. If God didn't make it, don't eat it pretty much, for the most part, we talk about the grocery store, like go around the edges.
Yes, I've heard that. The perimeter is the,
but I always tell them, I said, God didn't make anything in a box or a bag. Right. But he did make, in our society, we do put bags of rice and beans, but I'm not talking about going buying the box of like rice-a-roni. Sure. I'm talking about rice, and then if you want to add to it, add you some garlic or peppers or do something saute. Right. So we go through nutrition. Also, I mean, we're making sure sleep hygiene is really good. Exercise. I mean, exercise is important. Stress reduction is important. Family and friends. I do, I make sure in their questionnaire, like, like, what are your hobbies? Like, what do you do for fun? Who's your social support? So making sure, because I will have some people say none, and then you really need to talk to that. And sometimes you need to be that kind of counselor to them, or that kind of, I'm not going to be their friend, but have that friendliness to helping them get better. And that's what my team helps too with that. If we see someone that's like, I don't do anything for fun, or I'll do work for fun, we try to like point them to like, hey, let's find out other hobbies, or tell me about, hey, you said you liked to I heard you said you went hiking. You did, that is fun, get out and hike. So I just think you have to understand, like, all those things are important. It's not all about medicine. Yeah, for sure.
So if you've been dealing with chronic facial pain or headaches or fatigue or any sort of sleep issues and you just cannot seem to get to the bottom of it, and you're tired of just treating the symptoms without knowing what's really going on, you've heard Dr. Hartsfield talking just now. You've heard that for her, it is not just checking the boxes. It's not just, here's what I see on paper, here's the treatment that matches that, and we're done. She will take the time to actually talk with you and listen to you, really listen to you, and get to know you as a whole person and figure out the root of the issue. So make sure you check out their website. This is TMJ and Sleep Solutions of Alabama, Dr. Amy Hartsfield. And thank you so much for talking with us again.
Thank you, Ann.